Hello, I'm Dr. Tess Mauricio. We should all be beautiful inside and out.
The Dr. Tess Show. The Dr. Tess Show. The Dr. Tess Show. The Dr. Tess Show. When it comes to beauty, they say she's the best. But who is this woman they call Dr. Tess in your life?
This is the Dr. Tess Show.
Hi, I'm Marie. I'm from San Marcos, California.
Right, so Marie is actually one of my really good Facebook friends, and she's been my patient as well for a long time.
I've been running since 2000, and I was doing like short, quick runs, like 10Ks and half marathons. I've been running for many years, and all that has taken a toll on my joints, my knees in particular. So when I found out that Dr. Tess is doing the stem cell procedure for her patients with orthopedic problems, and she was posting it on Facebook, and I was thinking, oh my God, I gotta have this done besides my face.
Of course, I post on Facebook about the success stories of patients that we've treated with the regenerative stem cell therapy for knees. I actually did a TV segment with my personal trainer, Rico, and he had completely gotten rid of all the cartilage of his knees. His orthopedic surgeon said he's gonna need a knee replacement. So she followed that, and she started getting interested. She is an avid marathon runner, and she's always on the treadmill. She's always posting on Facebook. I ran another 15 miles on the treadmill.
I said to myself, I don't have to wait that long to do a marathon again. And I just really need to do this, because I've been always scared about wearing my knee pads thin and end up getting my, bone on bone rubbing together. Oh my God, that's terrible.
Hi, Marie.
Hi, Dr.
Hi,
Tess.
that was your daughter.
Yeah.
Hi, Davina.
My expectations is to be able to beef up my knee pads eventually. I know it's not going to be instantaneous. It's going to take time to heal, and time is a great healer. I have to be careful too with my activities. Dr. Lee, Dr. Tessa's husband, told me that I have to take it easy.
So she's putting on close to 30 to 40 miles a week, and when she's training even more than that, any little bit of deviation is going to be exacerbated. So if she's got a little bit of an angle, and it's closer, the gap in her right knee is closer on the outside of her joint than on the inside. So she's going to wear that part of her knee more, and that's actually where she's feeling most of her pain.
You gotta slow down, he told me. You gotta eventually train yourself to slow down too.
And she said, do you think that if I have the regenerative stem cell therapy to my knees, that's going to extend the years that I can do what I love, which is running? And I said, Marie, let's do it.
I'm excited. I'm also slightly bit nervous, but I guess you can say I'm a veteran when it comes to these things. I've had other parts of me worked on. So, and this is really no big deal. It's an in-clinic procedure, and it's simple, although for me, the payback will be immense. I know it will be.
So I know that Dr. Lee went over your x-rays with you, and you kind of see where things are. So, your knees are not terrible, which is good. So basically, regenerative stem cell therapy, it is using your own body's fat cells. There's really nothing to lose. It's your own stem cells. We're gonna harvest and remove some of the little tiny amounts of fat that's still left. The success rate of using stem cells to treat knee problems, it's very, very, very high. So there's really no downside. Obviously, it's a small procedure. I explained it to her. What we're gonna do is really just enhance your ability to rebuild collagen and also decrease some of the inflammation and all of the wear and tear that happens with your crazy active lifestyle. And what they found over 10 years of studying stem cells is that our own fat cells are very rich in regenerative stem cells. Basically, these stem cells can go to areas where there's injury, disease, and can differentiate or change into cells like collagen, cartilage, and also cause decrease in inflammation and heal the areas that are inflamed or hurting or diseased. You're gonna change, I'm gonna mark the areas you really have very little fat because of how how active and how fit you are, and also we've done some lipo in the past, so that's totally flat. I'll get a little bit of the waist, the hip area, and that should be enough fat to reprocess to stem cells.
Dr. Tess did my lipo years and years ago, and that was a full liposuction to get rid of all that loose fat from bearing, 2 children, one of which is here today. So this is going to be, this time it's a simple lipo on the side, so that'll be good. That'll curve my sides a little bit more. And it'll be enough, though, to be able to harvest the stem cells out of the body fat. So.
And then after that whole process, then the stem cells will actually be re-injected back in your knees. There are a lot of other stem cells that are offered outside the country, from Black Sheep, from other places, and it's not your own cells, and I'm not comfortable offering that to my patients, but I'm very comfortable removing fat because this is the same tickle lipo technique that I use to shape people's bodies. Okay?
I'm excited.
All right, well, I'm excited too because like I said, you're an inspiration. We got to keep you going, right?
The Dr. Tess Show. The Dr.
I'm so blessed to have a successful career in show business and be a wife and a mother at the same time. After my second child, napansin ko na parang tumaba ako. And I'm so lucky to find the best, si Dr. Tess.
Women's bodies change after childbirth. It's almost impossible to get back in shape after having kids. Our tickle lipo procedure will get that body back.
Ladies, we can get our sexy back.
Dr. Tess, simply the best.
It's really important for me to look my best at all times, and Dr. Tess knows this. That's why she introduced me to Lifeline Skincare.
I found the most amazing technology. It is stem cell technology. These stem cells are not embryonic.
Usually a few days after using the cream, you start to see your skin becoming brighter.
I've been getting a lot of compliments about how great my makeup looks, but I have to stop and tell them it's not my makeup, it's my skin. I got mine at mbeautyclinic.com. Get yours today.
The Dr. Tess Show.
One of the great advances in liposuction technology is really the ability for us to do it under local anesthesia, which means the patients are not under general anesthesia, which means they're awake. We do give them oral sedation. They take some happy pills. Okay. All right, you're all good. So everything's marked. So Bree will bring you in the procedure room. We'll get started. Okay, how do you feel? Are you feeling a little sleepy at all?
Relax.
Relax?
Very much relaxed.
Okay, all right. Just let us know because you only took one of the Ativan.
Oh, she made me take another one.
A second. Okay, all right. So that will kick in. It will be good maybe around 30 minutes because you're still very awake. So I want you to be a little bit more sleepy. Okay?
Okay.
All right, perfect. All right, I'll see you in there. The very first part of the procedure is me administering the numbing medicines. Of course, she's not numb yet, so she's gonna feel a little bit no matter what I do. But she feels the very beginning, and there will be areas that are sort of more sensitive than others. But within a few minutes, the whole thing is numb, and she's comfortable, fell asleep, and then I turned her over, and then we did the other side. So that takes maybe a quick 15 minutes. Hey Marie, how are you doing? Pretty good?
Pretty good.
Okay, that's coming up. Well, the easy part is the lipo, which is really the tickle lipo technique. She wasn't that ticklish. Marie is less ticklish than most patients, but she still felt a little bit of tickling as I got up to the waist area. Marie was really mesmerized, and she was actually almost shocked that I was able to find some fat and that it was traveling from the cannula all the way down the tube into the canister, and she was seeing the droplets of fat just kind of accumulating, and after a while she's like, wow, there's fat there. Let's give this
Brian Dennis Leonard from Bell Medical Equipment. How are you doing?
There is a company, Millennium Technologies, that come in that actually takes the fat and process it down to stem cells. That's done on the same day that the patient comes in. Takes about 30 minutes for that procedure, and then the stem cells are there, and we can use the stem cells, and for Marie, we're going to re-inject it back in her knees.
My name is Dave Angeloni. I'm a clinical scientist with Millennium Medical Technologies. As not only the acting president, but also as the chief scientist, I do get called upon a lot through over 100 different users to help service our clients, our physicians. We're a US-based company which really is on the forefront of regenerative medicine.
David is really the head of Millennium Technologies. They are the leaders in regenerative stem cell therapy in the United States. Marie! Got your stem cells. Relax. She's slightly, actually a lot sedated, and she was sleeping there, and we woke her up and then got her sitting up.
Relax your legs. Just let it dangle.
The process of injecting the stem cells in the knee, really what we do is we numb the area of the skin, and unfortunately we can't numb under the skin because introducing lidocaine or the numbing medicine can affect the survivability of the cells. It can actually kill the stem cells. Your stem cells are going in, Marie. That's it. Easy, simple. Just like that. How is it? Not bad. Yeah. Exactly, it's in there. You just have to do your other knee, then you're all done for the day. Okay? All right. Our hope is that Marie will get some immediate benefit in that the pain that she has with just regular activities will go away, and eventually she'll be able to run without pain and also extend the years and the life of her marathon running, because as it's going, as we all age, we're breaking down collagen, she's breaking down fast. We want that degenerative process to really slow down, and that's why she's doing this procedure.
I'm Jennifer, and I'm 58 years old. This was me a month ago. I could hardly look at myself in the mirror. This is me now. I didn't think it was possible, but I feel and I look great. And the best part is that I did it all without having surgery. It's as though I stepped into a time machine and I look 10 years younger. Thank you, Dr. Tess.
You're welcome, Jennifer. If you're like Jennifer and you want to look younger, call one of our M Beauty clinics near your area. Step into our time machine and we'll bring you back.
In this business, your face is your #1 asset. It's the canvas for all your emotions. How's that for drama?
Hilda Cornell has one of the most beautiful faces in international cinema.
So you want to be sure your face is well taken care of. So I go to the best. I go to Dr. Tess.
We customize our treatments to your individual needs. Our time machine program can make you look 10 years younger in a natural way. It's super high-tech and very economical.
Dr. Tess, simply the best.
One of the thrills of my adult life is actually having a chance to sing with the legendary band Side A. And those of us who grew up with Side A, and their beautiful songs, I mean, I was just thrilled that they were, in Southern California performing. And when they told me that Dr. Tess, maybe you can sing with Joey, I'm like, with Joey? Yes, yes, yes. I didn't even know. And the problem was, I didn't know what song we were gonna sing. Not even until like the day before. And it was a crazy, crazy week for me. Had back-to-back clinics, multiple lipos. Of course, when I have to leave the clinic a certain time, it never happens. And so I was supposed to be out of the clinic at around 2 o'clock because I had to travel from Glendale. I told my staff I have to be out by 2 because I have to practice my duet. And I still had to drive to Anaheim. But I didn't get out of clinic until 4, until we were panicked, and they were calling me, they were texting me, they're like, Dr. Tess, and we're starting, they're already starting, you know, the opening acts are starting, and we were panicked. Thank God they didn't have the regular and usual LA traffic coming down to Anaheim because I would have been late. By the time we got there, the producer who was setting this whole thing up for me was panicking. And then they said, okay, Dr. Tess, there's no more time to practice. You just gotta wing it. And I've never met Side A at all. I've never met Joey. And they just told me, you know, we were gonna sing this song. It was just gonna be in front of thousands of people. That was gonna be my one chance because I did not get to practice.
I'd like to call on America's favorite dermatologist. I'd like to call on Dr. Tess Mauricio to help us out.
Hello, everyone. I didn't get a chance to change clothes. I was actually wearing what I wore to the clinic. I'm like, man, this is gonna be my one time on stage with Side A, and I wasn't even like made up, but there's no time. And I was greeted by my buddies, Anjanette, Abayari, and Patricia were there. They're like, yay, Dr. Tess, you're gonna sing, and you know, and I'm like, okay guys, don't set yourselves up, you know, you might be disappointed. I did not get to practice, and I've never even sung Foolish Heart in my entire life, but that was the song that Joey said we're gonna sing, and I wasn't about to argue because I just want to sing with Side A.
I'm so blessed to have a successful career in show business and be a wife and a mother at the same time. After my second child, napansin ko na parang tumaba ako. And I'm so lucky to find the best, si Dr. Tess.
Women's bodies change after childbirth. It's almost impossible to get back in shape after having kids. Our tickle lipo procedure will get that body back.
Ladies, we can get our sexy back.
Dr. Tess, simply the best.
My first guest is America's favorite dermatologist, Dr. Tess Mauricio.
17 million people in the U.S. suffer from acne of all ages, and I've had acne my whole life.
Dr. Tess Mauricio is here with more on how to recover the younger you. Thank you.
America's favorite dermatologist, Dr. Tess Mauricio, here with her very happy patient.
America's favorite dermatologist, Tess Mauricio, is
and here to debunk some common myths is dermatologist Dr. Tess Mauricio. Hi, how are you?
I tell everyone, I'm the one that came up with this brand name of America's favorite dermatologist, because when I met her, I'll never forget, she comes walking in, you know, she was there with 3 other doctors, 3 other medical doctors, other dermatologists, but Tess was always a standout, not just because of her appearance, but this positive energy. She walks in, she's friendly to everyone. You know, you always say you could judge people based on how they're friendly to the little people. You know, the interns, the camera guys, she's smiling, she's happy, and right off the bat, she made me feel comfortable.
Nakita ko si Dr. Tess sa TV on the talk. I saw she was Filipina, and you know, she seemed very personable. She wants to help people feel good about themselves, and you know, being a dermatologist, sabi niya, you could see it right away that when you help someone, they're so happy, and I think that's great that, you know, she can do that and she can make us feel better about ourselves.
Hi, it's Jessica Sanchez, and I'm here at M Beauty with Dr. Tess. I met Dr. Tess through a mutual friend, and she is amazing, and everything that she's done for me is amazing. She's just an amazing person, the kindest, and I'm so glad that she's my friend.
We can make your acne scars disappear to a point where acne will be just your little secret.
July is a huge month for the M Beauty team. We have so many birthdays. There's Lisa, there's Rick, and then there's Cheryl. And so I decided, because they're doing such an amazing job, you know, over the last year, less than 1 year, we opened 3 new clinics. There's just so much commotion, and these people are working so hard and so dedicated. And so I said, okay guys, as a treat, I'm going to take everyone to Vegas, and we're gonna have a Vegas night for M Beauty. And so we bought tickets for everyone to go to what they call the package tour, which is New Kids on the Block, 98 Degrees, and Boys to Men concert. And it's fantastic. And so we all got together. It's crazy, okay? When the Mauricio family travels, we travel in packs. So it's like 3 huge cars, lots of kids, lots of craziness, lots of luggage, but we finally managed to get to Vegas. And you know, just coordinating a lot of people, there's about 20 of us, is crazy, and it gives James a big headache.
Traveling with all of the Mauricios, okay, how can I do this without? It's not anything new. I mean, they're at my house all the time, and they're a very close family. Very close.
There's Rick, there's Marie, there's Lisa, there's Cheryl, there's Ashi, there's Amara, there's Angela, there's Austin, Christian, Arvin, me, James. I hope I didn't forget anybody. I think that's everybody. The concert was opened by Boys to Men. And if you haven't seen Boys to Men in concert, they are phenomenal. Phenomenal singers. It's just, you can't believe the talent in this group. And then it was 98 Degrees and Nick Lachey. Marie, my sister-in-law, is a crazy Nick Lachey fan. She was screaming like a teenager for Nick. And of course, you know, the 98 Degrees wore their wife beaters, which is so corny, especially to think that they're like in their 40s. Come on guys, but when you're in there, it like made sense, you know? And then finally it was New Kids on the Block. And New Kids on the Block, I mean, they've been around the block. I mean, I don't even know why they're called New Kids still. But they actually look really good. Like from far away where we were sitting, if you're just looking at their bodies, the way they move, the energy, you would think that they were still in their 20s, which was inspiring because, you know, I'm also like early 40s. It's like, gosh, that's really how you should be now, you know, when you're in your 40s. There's no reason to feel old and act old. The only thing is that when they focus close up on their faces in the big giant screen, we're like, time machine! They need the time machine. And everyone said that too in our group, which is kind of crazy, but hey, you know, it is what it is. We would love to make over Nick Lachey and Jordan Knight. So if you're gonna watch this, maybe they have some Filipino friends or girlfriends or housekeeper, I don't know. Hey, then, you know, let them know, because time machine, it really will bring them back, because their bodies, their energy's there, but you know, the wear and tear and the aging is showing on their faces. But overall, it was a fantastic experience. We loved it. We had a ball. We had a great time, and definitely I hope that, you know, we get to do it again very soon.